Salt substitutes can play an important role in helping you lower your blood pressure and reduce the risk of heart attack, stroke, and chronic kidney disease. Instead of relying on traditional table salt, you can use potassium-based salt substitutes and natural flavorings to season your food without adding excess sodium. Commercial salt substitutes. Many commercial salt substitutes are formulated with potassium chloride, which tastes similar to regular sodium chloride, table salt. For some people, potassium chloride makes an effective alternative. However, others may notice a slightly bitter or metallic taste, especially when used in larger amounts. Some products labeled as light or low sodium salts contain a blend of potassium chloride and sodium chloride. This combination offers a flavor that is closer to traditional table salt while still lowering overall sodium intake. According to a 2022 scientific review, potassium-based salt substitutes can lower systolic blood pressure, the top number, by as much as 6 mm of mercury, and diastolic blood pressure, the bottom number, by about 2 mm of mercury. These reductions may seem small, but they can have a meaningful impact on long-term cardiovascular health. Important safety considerations. While potassium-based salt substitutes can be beneficial, they are not safe for everyone. Individuals with advanced kidney disease, liver disease, or diabetes may be at risk of dangerously high potassium levels when using these products. For those with these conditions, the potential risks often outweigh the benefits. Before making the switch to salt substitutes, it's essential to consult your healthcare provider. They can help you determine whether potassium-based alternatives are safe for your specific health situation and recommend the most effective way to manage your blood pressure naturally. Vinegar. Vinegar is a versatile ingredient that can add tang, brightness, and even depth of flavor to meals. Balsamic vinegar, for example, offers a rich umami quality that enhances food naturally, without the high sodium content of seasonings like soy sauce or Worcestershire sauce. Research suggests that vinegar may provide more than flavor, it may also have a direct blood pressure lowering effect. The acetic acid in vinegar has been studied for its potential cardiovascular benefits. A 2022 review found that consuming about 30 milliliters, 2 tablespoons, of vinegar daily could reduce both systolic and diastolic blood pressure by approximately 3 mm of mercury. Citrus. Citrus fruits such as lemons and oranges are commonly used to brighten dishes with their juice or grated rind. Beyond taste, citrus contains powerful plant compounds, including eriocitrin and hesperidin. These natural chemicals have vasodilator properties, meaning they help widen blood vessels and promote healthier blood flow. This effect supports lower blood pressure while adding a refreshing flavor to your meals. Fresh or dried herbs. Herbs are one of the easiest ways to reduce salt while still enjoying flavorful meals. Dried varieties like oregano, thyme, rosemary, and sage provide concentrated flavor, while fresh herbs such as basil, parsley, mint, dill, chives, or tarragon can be used in salads, sauces, and stews. In addition to enhancing taste, some herbs may also support blood pressure management. Studies suggest that coriander, lemongrass, sage, and sweet basil may have antihypertensive effects, making them excellent natural options for seasoning food without added sodium. Spices. Spices are one of the most powerful tools for reducing salt in your diet while keeping meals flavorful and satisfying. Options such as cardamom, celery seed, cinnamon, ginger, saffron, sesame seed, and turmeric not only enhance taste but may also contribute to lowering blood pressure. Several of these spices are believed to have antihypertensive effects, making them excellent natural choices for heart-healthy cooking. Garlic. Garlic is a staple in countless cuisines and provides a rich, savory foundation for soups, stews, and sauces. Beyond taste, garlic is among the most well-researched natural options for managing blood pressure. Scientific studies show that garlic works by increasing nitric oxide, which helps relax blood vessels, and by blocking angiotensin-converting enzymes, ACEs. These are the same enzymes targeted by certain blood pressure medications, such as benazepril and enalapril. As a result, incorporating garlic into your diet may help naturally support blood pressure control. Onion. Onions offer a wide range of flavors, from the sweet notes of caramelized onions to the crisp bite of fresh red onions. Green onions and chives can also add freshness to salads, stir-fries, and other dishes without relying on salt. Like garlic, onions have documented antihypertensive properties. They help reduce blood pressure by blocking calcium from entering the smooth muscles of the heart, which slows the heart rate and eases strain on the cardiovascular system. Onions are also rich in quercetin, a powerful antioxidant that may lower systolic blood pressure by up to 5 mm of mercury. Pepper. Peppers add complexity and heat to meals, making them an effective way to cut down on salt while keeping food satisfying. Black pepper, paprika, chili pepper, and cayenne all deliver varying levels of spice that stimulate the release of endorphins, the body's natural feel-good hormones. This pleasant sensation can help reduce cravings for salty flavors. Black pepper contains piperine, a compound shown in some studies to promote vasodilation by blocking calcium flow into blood vessels. Additionally, a 2023 study from China reported that capsaicin, the active component in chili peppers, may modestly lower systolic blood pressure when consumed regularly. Seaweed. Seaweed is a naturally rich source of potassium chloride and contains very little sodium chloride, making it an effective salt substitute. Its natural saltiness enhances flavor without contributing to excess sodium intake. For example, toasted nori provides a distinct, savory flavor often used in rice dishes, while fresh wakame deepens the taste of fish soups and chowders. Beyond flavor, seaweed contains unique plant-based polysaccharides that bind to sodium and help eliminate it through urine. This process reduces water retention, which in turn can help lower blood pressure. Nutritional yeast. Nutritional yeast is a deactivated form of yeast prized for its rich umami flavor. It can be sprinkled on popcorn, pasta, casseroles, or mixed into salad dressings, soups, and sauces to enhance depth of flavor without salt. Although nutritional yeast does not directly lower blood pressure, it is packed with B vitamins, including folate and vitamin B12. These nutrients support cardiovascular health by boosting nitric oxide production, which relaxes blood vessels and promotes healthier blood flow. As part of a balanced diet, nutritional yeast can be a flavorful way to reduce sodium while supporting overall heart health. When it's time to switch. On average, adults in the United States consume about 3,400 milligram of sodium per day, far above the 2,300 milligrams daily limit recommended by the American Heart Association, AHA, for healthy adults. Most of this sodium does not come from the salt shaker, but rather from processed and packaged foods, which contribute more than 70% of sodium intake in the American diet. This makes reducing sodium a challenge, but also highlights the importance of choosing natural, flavorful alternatives. Certain individuals may be advised to limit sodium even further, cutting daily intake down to around 1,500 milligrams, especially those living with hypertension, high blood pressure, chronic kidney disease, heart failure. For these groups, replacing regular table salt with healthier substitutes is not just recommended, it's essential for long-term cardiovascular and kidney health. Take the next step toward better health. If you're looking to manage your blood pressure naturally, start by gradually reducing sodium and exploring the wide range of salt substitutes and natural flavor enhancers, from potassium-based salt blends to herbs, spices, citrus, garlic, and seaweed. Remember, it's always important to consult your healthcare provider before making dietary changes, especially if you have chronic health conditions. By making these small but impactful shifts, you can take meaningful steps toward lowering your blood pressure naturally, protecting your heart, and improving your overall health. Subscribe to HeInfo for more trusted, science-backed health information, and stay informed about the best ways to take control of your health naturally.